Hello everyone, my name is Keshav Goyal. I am from Agra. I was facing a neck pain issue in my C5-C6 disc problem, and I was referred here by my family doctor to Dr. Vikas Gupta, and he had done my surgery of disc replacement, and it was a wonderful and safe surgery. Before the surgery, I was facing a lot of pain on my neck, shoulder and arm, and my thumb was also numb. But right now there is no stiffness. My arm and hand is perfectly fine. There is free movement. I am feeling comfortable. I am fully satisfied with the surgery and the nursing staff also, and I am fully recovered now. And it will be taking only 3 days, and I am being discharging now. So I had a great experience here. Thank you, Institute of Brain and Spine, for giving me a wonderful experience.
Hello, we are going to talk about a patient today. He's a young individual, 32-year-old, who presented to us with a severe neck pain and severe radicular pain to the left side for last 1.5 months. He was so troubled with that he was not able to sleep, and he was not able to make a grip of the left hand. He came to us. The MRI showed a C5-6 disc prolapse with loss of cervical lordosis, which is the normal alignment of the spine, and that was compressing on the left side of the root, which was causing this problem. Now we advise surgery. Now there are two options for surgery in a case like this. The very basic one is fusion, where we remove the disc and fuse the segments. But in a young individual which has got a normal life and is going to be active for quite some time, we recommend cervical disc replacement, which is very helpful. And it was supposed to relieve his pain, and it is normally you don't require any collar, anything after that, and it actually mimics the absolutely normal disc morphology and function of the cervical spine. That is why it is recommended. The patient opted for cervical disc replacement, and we did that, and after that his pain was totally gone, and he is absolutely fine doing his normal daily chores, and he is fit for discharge today. And he does not require any collar, and he will be fit to join his office or whatever work he is doing within 5 to 6 days he can do. And the risk of any adjacent segment up or down which can develop disc in future is absolutely minimized by a disc replacement. So the message is that in a young patient, if he is the ideal candidate, disc replacement, cervical disc replacement is a preferred choice as far as surgery is concerned over the fusion. Thank you.
केशव करीब 1.5 महीने से दर्द और सुन्नपन से परेशान थे। हमने काफ़ी जगह दिखा लिया, न्यूरो फिजिशियन को भी दिखाया था, उनकी भी मेडिसिन चली, लेकिन कोई फ़ायदा नहीं हो पा रहा था। लेकिन यहाँ डिस्क रिप्लेसमेंट के बाद बहुत ही तेज़ी से आराम मिला है और पूर्णतः स्वस्थ प्रतीत हो रहे हैं।